Okay, let's get started. Welcome, everybody. You are at T-Course 3.0 CAsToR webinar series event. Today, we have the pleasure of having Doctors Abby Friedman, Lauren Tonti, and Holly Jarman present on working with state and local tobacco legislative data, a primer. So we're really excited about this webinar. We hope that you find it useful. Just some overview of the agenda today. Each speaker will have about 20 to 25 minutes to present. First, Dr. Abby Friedman would present on legal data in tobacco regulatory science, what, why, and how. Next, Lauren Tonti will present on the methods to extrapolate and translate data and introducing the concept of legal epidemiology. And then finally, we'll have Dr. Holly Jarman present on disentangling the causal mechanisms in qualitative and case study data, or case data. And afterwards, we'll do about a 15-minute period of question and answer. And you can always put your questions into the chat or into the Q&A feature on Zoom, okay, at any time. And then we'll get to those questions in turn during the Q&A sessions. We also strongly encourage you to complete the 5-question evaluation that will be sent to you after the webinar finishes. It takes a few seconds to complete, but it's very useful for us to track the quality and evaluation related to our webinar series. Just to give you more information about other webinars that we presented through CAsToR, all our webinars are available through our website and through our YouTube channel, and the links are provided in the slides, which I hope you will get soon, or maybe somebody will share them in the Q&A. Okay, so let me first start off with introducing our first speaker. Our first speaker is Dr. Abby Friedman. Dr. Friedman is an associate professor of health policy at the Yale School of Public Health and a faculty affiliate at the Yale Program in Addiction Medicine. She's a health economist by training, and her interests lie in researching the policy determinants of legal substance use, particularly nicotine and tobacco use. Her research applies quasi-experimental methodologies to estimate state and local policy effects on these behaviors and disparities of tobacco and nicotine use. And the goal is to inform policymakers to improve public health and to improve health equity. Her work includes papers estimating the effects of e-cig taxes, tobacco 21 laws, and flavor restrictions on conventional and electronic cigarettes use among youth and young adults. And Dr. Friedman is a co-lead of CAsToR Project 3 and PI of the Yale CAsToR site. So without much more, please, Abby, take it away when you're ready.
Thanks, everyone. Ritesh, can you just give me a signal that you can see my deck?
Yes.
Perfect. Absolutely wonderful. Thanks for having me. For context, I'm a health economist by training. My research uses natural experiments, typically leveraging variation in the timing and types of policy adoptions across the US to understand how policies impact behavior, particularly nicotine and tobacco product use. Conducting this research isn't just about econometrics. You need a strong understanding of the policies themselves to appropriately execute and interpret your results. That's where interdisciplinary work and a strong appreciation for the contributions of other disciplines and approaches come in, and they are critical. But let's start at the beginning. What is tobacco regulatory science? And what is public policy, for that matter? Regulatory science brings together science and policy to improve public health and safety. But if you look up what a policy is, you're going to find a wide variety of answers and very little agreement. I like Thomas Dye's answer for breadth, which is that a public policy is anything a government chooses to do or not to do. But in practice, we mean the laws, regulations, procedures, programs, and rules governments adopt to achieve their goals. For example, let's think about Tobacco 21 laws. That is, policies barring the sales of tobacco products to individuals under age 21. Tobacco 21 policies can be passed through legislation at the state and federal level. They can also be passed through Board of Health regulations at the local level or ordinances approved by town councils. In fact, although the federal law making Tobacco 21 the law nationwide was passed and signed into law in December of 2019 with an effective immediately effective date, it took FDA until September of 2024 to finalize the rules that were required to fully implement this law. For example, requiring retailers to check IDs for anyone who appears to be under age 30 when trying to purchase tobacco products. So while the federal law may have influenced behavior by, for example, spurring states to adopt their own Tobacco 21 policies, its impact was not due to full enforcement in the immediate time after that December 2019 law was signed. Understanding that kind of nuance is critical for your execution and the interpretation of policy analyses. A variety of tobacco control policies have been shown to impact tobacco and nicotine product use, from minimum legal sales ages like Tobacco 21 to smoke-free air laws to taxes, although taxation doesn't fall under FDA purview. Moreover, such policies have been shown to have unintended effects at times. A variety of quasi-experimental analyses show that policies designed to reduce access to e-cigarettes, reduce their appeal, or increase their price tend to increase combustible cigarette use. Such evidence suggests that these products are substitutes, which means that if a policy targets one of them, it's likely to not be limited in its impact to that product. And it tells us that in general, when looking at policies that target a single tobacco or nicotine product, we should be thinking about the potential unintended effects on other tobacco and nicotine products. Now, if you're going to conduct research on policy effects or use policy effect estimates to model the implications for long-run health outcomes, you need to be able to assess the quality of different studies' estimates, and particularly the likelihood that the estimate is causal and the likelihood that it generalizes to the population of interest to you. To that end, I'm going to present a brief overview of the different quantitative approaches to estimating policy effects. One second. Okay. Many quantitative analyses focus on a particular policy at the observational associational approach. In other words, how is policy X correlated with outcome Y in a particular group? These analyses are extremely common and they are extremely susceptible to confounding. Baseline smoking and vaping rates often differ between the states that adopt versus do not adopt restrictive TRS policies. In fact, they often differ between the early adopters and the late adopters. Also, states that tend to adopt one more restrictive tobacco policy are also more likely to have already adopted other restrictive tobacco policies. So there are all kinds of confounders. And what I would watch out for here with associational studies is overstating implications. It is something that we often get dinged on. If you're in the peer review process and you see this, you'll say that shouldn't be causal language, but sometimes it gets edited back in at manuscript review. So with associational, you're really not talking about a causal estimate. Quasi-experiments leverage natural experiments and can generate causal estimates if key assumptions hold. All right. The key things you need to watch out for here are whether the author executed the analysis correctly and whether they executed the accepted tests that allow you to conclude that it is likely that the underlying assumptions required for causal interpretation hold. I've seen an increasing number of papers outside economics journals claiming to conduct difference in differences analysis, perhaps the most common type of quasi-experiment we see in the tobacco literature, but with clear specification errors and without assessment of the key assumptions. RCTs, randomized controlled trials, most people are going to be familiar with this one. These will give you causal estimates when executed as they should be. The problem with an RCT that you need to keep in mind is twofold, and it really is, they're both about generalizability. There's external validity and there's Hawthorne effects. The fact that you're being studied changes your behavior, especially if it's a stigmatized behavior. And moreover, the effect on a group being studied may differ from the effect of a policy on them and all of their peers in their geographic area. Finally, we have evidence syntheses. These can take the form of systematic reviews, meta-analyses, ideally both. And the approaches draw conclusions based on a body of literature, addressing a particular question, not a one-off of a single study. These are incredibly useful, as long as the study quality is carefully assessed and considered. They're ultimately only as good as the studies they include. I've seen a number of these that are excellent, and I've also seen some where they misapplied grading of the particular studies, and they graded associational as equivalent to RCTs, for example, or omitted key papers that contradicted their findings. So whenever you're reading an evidence synthesis, you want to be really sophisticated and attentive to papers that have been excluded, and to how the quality of the evidence is graded. In summary, if you're modeling the impact of a policy on an outcome, you should be looking at papers where the methods can legitimately claim to give you a causal estimate and are likely to generalize to your population of interest. I'm going to take a few minutes to build your intuition around the distinction between purely associational studies versus quasi-experimental, focusing on difference in difference estimation. This is one of the most common quasi-experiments we see. The graph here plots a stylized example. So you've got the outcome variable on the y-axis, you've got time on the x-axis. This dashed line is marking the effective date of a policy that you're analyzing. And then you have the trend in the outcome for the adopters, beta A, and the non-adopters, beta B. And what you see here for a DD estimate is that we're going to subtract the change after, or excuse me, the difference between the adopters and non-adopters after the policy from the difference before the policy, assuming that these trends are adjusted for underlying covariates. In that case, that will give you the diff and diff estimate. And what that does is it takes out the difference that pre-existed the policy between these two groups. And if you can legitimately assume that the trend in beta B is a legitimate counterfactual for what beta A, what the adopting states would have done if they hadn't adopted the policy, then that gives you causality. And that's what the assumptions are inherently trying to check. So just to make sure it's clear why this might be more useful than an associational study, I'm going to put forward two examples of naive association estimates. With option one, it's simply a post-treatment association. You're looking at the relationship between the policy and the outcome, comparing adopters to non-adopters in the post period. The problem is this is going to overstate the policy impact if there was already a pre-existing gap between the adopters and non-adopters here. See? Because in this case, if you say that the effect of the policy is beta A post minus beta B post, you're also attributing the pre-existing gap and what you think that gap would have been in the post period as part of the policy estimate, right? So that one will be biased. Alternatively, we see associational studies that look pre-post within adopters only. And that estimate can be the right estimate if there was no change in the trend for non-adopters. But if at the same time as the policy was adopted, anything else changed that would have changed the outcomes, like in this example where we see the non-adopters also showed an increase that couldn't be due to the policy because they didn't adopt it, then again, that second approach is going to bias your results and it will no longer be specifically the policy's effect, right? Essentially, the difference in difference approach is asking if the gap between the adopters and the non-adopters changed in response to the policy. Given that intuition, I want to emphasize that you should not assume that all papers presenting a quasi-experimental analysis are created equal. As these methods have become more common, we see more issues popping up, and also the literature on how to execute these has changed rapidly in the last 10 years. The key issues I notice are people overestimating their methodological expertise, and we see that when they ignore the assumption tests or they misspecify the fixed effects or the approach is outdated. We also see it if an analysis omits key covariates, and that often comes from overestimating your subject matter expertise, right? When someone doesn't realize that because they're studying flavor restrictions, they probably need to also account for taxes on the products. Also, we see naive policy variables, which may overestimate subject matter expertise or overestimate your understanding of policy per se. So using the wrong effective date, oversimplified representations, for example, binary variables when you really should have been using a continuous variable. And then finally, the other key challenge we have are overstated implications or understating limitations. This can come from failure to fully understand the methods or the subject matter or legal epi, but it can also come from failure to check your ego at the door. And often, I would say that seems to be what's going on. Each of these pitfalls can be avoided. Building your subject matter expertise will help you recognize the right covariates and properly interpret the policy variables. It'll also build your intuition for when an estimated effect is too big to be plausible, which is a critical and often overlooked element of these analyses. If you're implementing the analysis yourself, you're going to need training and quasi-experimental methods if you want to generate that parameter in order to do it correctly. And you also need to make an effort to follow the literature because in the last 10, even 5 years, the methods have evolved in real time. Similarly, if you're identifying policies accurately and describing those variables appropriately, you need at least a basic understanding of legal epidemiology. But if you're collecting the data yourself, you need more than basic. Finally, in my experience, the best way to avoid overstating the implications of your work is checking your ego at the door. In economics, the field teaches you this by trial by fire, essentially a tradition of no holds barred seminar presentations, when seminar attendees will stop your talk mid-talk to tear down a claim that's not supported by your methods or your data. You learn to avoid making those claims pretty fast. But to be honest, all of these skills are a lot to ask from a single researcher, particularly if your goal is not to generate policy impact estimates, but to apply them in a simulation model estimating broader or long-run implications. The real solution is actually much simpler, and it's interdisciplinary collaboration. You don't need multiple PhDs. You don't need to go get a JD. You need to build a network of collaborators to fill in expertise where yours is weaker and learn to speak each other's languages and respect their contributions. To be even more concrete, I'd suggest the following process. Your starting point is evaluating your value add to the type of research you want to conduct. Where is your expertise strong? Where are there gaps in performing that research rigorously? And also, what are your capacity constraints? You shouldn't be thinking about getting a second PhD or a JD if you don't actually have the capacity to do that. There needs to be another option. The next step is to find collaborators that fill in those gaps that you can't fill in yourself. And once you've done that, you're not done. You have to learn to speak each other's language, not just the terminology, but you need to understand the common assumptions and standards underlying the work they're doing to make sure that you're aligned in your contributions. Stay curious, be okay with admitting when your understanding is incomplete or incorrect. And I'll say personally that the Center for the Assessment of Tobacco Regulations really has exemplified this approach for me, bringing together modelers, health economists, qualitative researchers, epidemiologists, legal experts to ensure that the work avoids these pitfalls. And this workshop is just an example. Lauren and I, for example, collaborate on several projects that involve collecting novel policy data and analyzing their effects. And Holly and I will talk, probably more often than we actually have time for, whenever I'm questioning whether the policy described on paper actually fits the true process, or there's a qualitative and political underpinning that might be important to account for. So I want to leave you with one reflection on this. Working with CAsToR, I found that being forthright about the limits of my own knowledge not only improves the quality of our research, but makes the process a lot healthier and a lot more fun. Right? With team science, you're asked to show up fully for your collaborators. With interdisciplinary team science, there is an active value placed on being willing to say, I'm not sure. Can you help me understand this? And highlighting another person's insight or bringing them in when the expertise isn't there. Everyone gets to learn from each other, so we all get to occupy the role of learners while leading. And this ethos improves the quality of the resulting work and the quality of the time spent concluding it, which I think is really invaluable. So with that, I'm going to hand off to Lauren.
Thank you so much, Abby. That was wonderful. As Lauren gets her slides up, I'm going to say a few things about Lauren, give you a little background about her. Lauren Tonti is a legal epidemiologist at the University of Missouri Department of Economics and the Law and Policy Core Lead at the Social Impact Lab. A public health lawyer by training, Lauren examines the intersection of law and public health through social determinants as a lens. Lauren previously served as a public health analyst contracted with the Centers for Disease Control and Prevention's Office of Public Health Law Services. In her role, Lauren provided vital technical assistance to state, tribal, local, and territorial partners and conducted comprehensive legal epidemiology research and analysis on a variety of public health topics. As a doctoral candidate and scientific researchers at the Max Planck Institute for Social Law and Social Policy, she conducted comparative and global health law research examining the legal determinants of telehealth quality and pandemic preparedness. Thank you very much for being here, Lauren. Please start when you're ready.
Thank you so much for the opportunity to speak today. Thank you also, everyone, for being here. I'm one of those happy collaborators that Dr. Friedman mentioned. I am a public health lawyer and legal epidemiologist. And today I'm going to introduce legal epidemiology to help you think about how you can use law and policy information accurately and meaningfully in tobacco research. We're going to explore some key questions about legal epi, as we like to call it, and public health law research concepts, so that by the end of my time with you, I hope that you feel willing to engage with laws and policies, you feel more confident interpreting and coding and using legal data in your work, and to learn about resources of how to further engage with the legal epi methodology. So we've been talking already quite a bit about legal epi, but I want to start us off with a clear definition so that we're on the same page. Legal epidemiology is the scientific study of law as a factor in the cause, distribution, and prevention of disease and injury in populations. It helps explore whether a law can be empirically shown to affect health outcomes. Essentially, we're treating laws and policies as measurable exposures in natural experiments. It uses systematic, structured methods to collect and analyze legal data within established methodological frameworks. The methodology is based in the scientific method. So methods support accuracy. It helps ensure the legal information that you're using is correct and precisely coded. It also helps us replicate and reproduce our studies and results. So established methods allow others to recreate and validate their study. So just like you would want any other type of variable, legal epi helps us produce replicable and reproducible science. We also have a lot of nuance in the methodology. So we have a structured approach that helps us understand legal complexities so that you can select appropriate analytic strategies. A well-defined legal variable will only help strengthen your study design. And finally, transparency is big in the field. Legal epi requires acknowledging limitations and clearly documenting methodological decisions. It's also inherently transdisciplinary. So legal epi teams often have members from different fields, and it's a method that draws from law, from public health, epidemiology, economics, and policy analysis. Laws shape environments, behaviors, and access to resources. So in the tobacco policy space specifically, we have sales restrictions, we have licensing schemes, we have flavor bans, we have clean indoor air mandates, among other behaviors that shape the tobacco environment. So all of these are implemented through law and policy. Legal epi allows us to compare laws across jurisdictions and to track changes over time and to evaluate how policy design features influence outcomes. Legal epi has two core components. So we have legal evaluation, which overlays legal data with health outcome data to measure law's impact. But I'm going to talk more about legal mapping with you all today. So legal mapping is the process of systematically capturing key features of laws and identifying how those laws vary across jurisdictions and over time. Legal mapping has two main forms. So we have policy surveillance and legal assessment. Policy surveillance is the ongoing systematic collection, analysis, and dissemination of information about laws relevant to health. It produces longitudinal data sets. So for example, we could map smoking bans from their initial adoption through the present. Tracking those laws over time allows us to identify trends, like expanding smoking restrictions in restaurants and hospitals, bars. Policy surveillance captures legal change as it unfolds, whereas legal assessment collects data at a single point in time. So it produces cross-sectional data sets. For example, mapping all smoking bans currently in effect today would constitute a legal assessment. So it tells us what the legal landscape looks like at that moment, but not necessarily how it might have evolved. If we take Tobacco 21 as an example, looking at Tobacco 21 laws that were in effect in 2020, that would be a legal assessment, a snapshot at one point in time. If instead we track Tobacco 21 laws beginning in 2000, 2013 and followed their spread across jurisdictions, that would be policy surveillance, examining that change over time. And documenting that change really matters, right? So in 2013, only 8 U.S. localities had adopted Tobacco 21 laws. By March 2016, that number expanded to 125 localities. States at the state level also followed suit, and then the first federal Tobacco 21 bill was passed in 2019. So that progression is exactly what policy surveillance captures. So this graphic depicts legal mapping, and this is a process that can be applied in both policy surveillance and legal assessments. So as you can see, it's a nonlinear process, and in total there's 8 discrete but iterative steps depicted in a wheel. In a nutshell, legal epi involves defining the scope of your project, conducting background research, so really nailing down that research question, developing coding questions, collecting the law, identifying the appropriate level of law when you collect it, creating the legal text that you want to analyze and you want to code, actually coding the law, so applying your questions, and then translating into numerical information, and then publication and dissemination, and finally tracking and updating the law, because legal epi does not end. When the study ends, laws are not static, they do change. So it's important to keep the tracking and updating in mind when you think about data sets. There are elements that you want to consider and when you're creating a legal variable. So I'm going to refer you to this paper by Barsky and co-authors on improving the transparency of legal measurement and health policy evaluation, a guide for researchers, reviewers, and editors. So it really spells out that when you report working with law or policy variables, there are things that law and policy folks are going to look for. And sometimes if those things are missing or unaccounted for, that's a red flag for us. It causes us to question the extent of your findings. I'm also raising the example from Drs. Friedman, Pesco, and Whitaker from JAMA Health Forum in 2024 that examined flavored e-cigarette sales restrictions and young adult tobacco use. So in the supplement to this paper, they describe their methods. So it was a study that required careful identification of jurisdictions that had flavor restrictions. It required coding and scoping of those restrictions and aligning effective dates with outcome data. And now I know that because I could look into the methods in the supplement and see. We can see how that data was collected and identified and how they came to consensus on the coding. So if you are writing a paper using a legal variable, or if you're reading one, please consider, if you're writing one, to include that information in the body text, and if not, in the supplement, so that we know the background about your legal variable. That was an example of a paper and publication that you can find legal epi work in. There are other places you can find legal epi studies and policy data sets on a wide variety of topics, but make sure, especially if you want to use a data set that you didn't create yourself, that you understand the methods of how that data was created. If you don't know how a legal variable was constructed, you may not be able to properly interpret it. So there are trade-offs to using external data sets. When you use an external data set, it could save you time, but you don't know if, say, they coded the effective dates right, potentially. What you can do is ask for the author's codebook. If the authors maybe can't give you one for a particular reason, if you can't find anything about their methods, maybe you want to raise some eyebrows about that data set, but you want to be able to defend your coding if you create it yourself, or if you use someone else's coding, you want to be able to defend that as well. When working with state and local tobacco laws, you want to keep in mind at least 3 concepts: relevant authorities, preemption, and effective dates. So ignoring these might result in the misclassification or misinterpretation of results. If you don't know what any of these things are and want to use legal data in your tobacco research, please give a listen now, and then we can walk through them at warp speed today, but come talk to me later and we can go through these with a fine-tooth comb. It's important to distinguish among the types of laws in play because they can carry different authority and legal effect. So all laws are policies, but not all policies are laws, and both statutes and regulations have the force and effect of law, even though they are distinct things. You have to match the level of law to your research question. Some outcomes are shaped primarily at the federal level, others depend on state or local level regulation. If you ignore one level of law, you may risk misclassifying your legal exposure. In tobacco work specifically, federal, state, and local laws often interact, and accurate legal measurement requires attention to all those relevant levels. There's also significant heterogeneity across states, so especially in how authority is delegated to local governments. Dillon's rule and home rule really exemplify that. So in home rule states, local governments are granted broad authority. They can enact local police, health, and safety regulations so long as they don't conflict with state law. In contrast, under Dillon's rule, local governments only have those powers that are explicitly granted by the state legislature or clearly implied from a specific grant of authority. If you don't understand the type of rule a state follows, you might assume local authority is the same everywhere, when in fact it may differ dramatically, even at the county level. It can also differ by domain. For example, the authority to tax may be different. So if you assume local governments have authority to enact a tobacco control policy without verifying the state's governance framework, you might be misclassifying whether that law is legally operative in the way that you think that it is. And you can't always assume that a law operates the same way across every state either. That's also really important. So understanding the delegation of authority in context is really essential to legal measurement. Preemption is a legal principle under which a higher level of government overrides or limits laws enacted by a lower level of government. So it occurs when the law of a higher authority invalidates or restricts the authority of a lower level in order to regulate a particular issue. So preemption is often discussed in the context of federal law, displacing state law, but states are also frequently using preemption to limit the authority of cities or counties across many policy areas, particularly in public health. So bringing up our Tobacco 21 example again, it provides an example of that layered authority. So local governments can adopt Tobacco 21 ordinances. States could also later enact statewide Tobacco 21 laws. And then in 2019, we had that federal law establishing a nationwide minimum sales age of 21. So that federal law sets a floor now. So states and localities cannot go below that minimum policy. States and local governments can, however, adopt stronger complementary measures like enhanced enforcement or retailer licensing requirements. That is, unless state law preempts local action. So preemption is definitely a force to consider. We also can't forget about courts. Courts interpret statutes and regulations. Judicial decisions can clarify ambiguous provisions. They can invalidate laws. They can alter enforcement practices. For example, if a court narrows the scope of a flavor ban, that changes the practical legal exposure in that jurisdiction. So before federal Tobacco 21 law, some local and state measures might have been challenged on preemption grounds, arguing that the state law prohibited local action. These cases shaped how Tobacco 21 policies could operate and where they operated. Courts have historically upheld age-based tobacco sales restrictions as valid exercises of state police power, but courts also play a critical role in resolving conflicts among federal, state, and local tobacco laws, particularly when questions of preemption arise. For legal epi, we also have to consider how courts interpret and apply the law in practice, because that really impacts timeline and the continuity of a law or a policy. The effective date is something that's important to consider. It's not straightforward always. So an effective date is when a law becomes operative and enforceable. It is not the same as the adoption date or the enactment date. So adoption is the legislative vote. Enactment is a formal approval. The effective date is when the law actually takes legal effect. They're not always explicit. Some are written directly into a statute. Others are determined by default administrative rules that might be found elsewhere in a state's code. But every law and every amendment to that law has one. Because procedures vary across states and between state and local levels, it's essential to verify the correct date and how that date is determined. Using adoption or enactment dates instead might misclassify your exposure and potentially bias your results. So this was only a very brief introduction to legal epi. There is hopefully, now that you know, there's a method for creating rigorous legal variables and to extract quantitative information from laws and policies. You'll be interested in learning more. I hope you've seen that legal epi expands what we can measure, but you want to accurately extract variables and understand the limits of your results. And just to reiterate what Dr. Friedman said, working interdisciplinarily can really help you do that, and I encourage you to do that as well. And I'm going to pass it over to Dr. Jarman, who can tell you more about understanding the limits of what this type of data can tell us and understanding what inferences can and can't be drawn, including from qualitative data, because it's an important part of using legal epi in your research. So there are some foundational resources that I've also left for you here. These are really good starting points. I, for example, in the Social Impact Lab, host drop-in sessions. They kind of operate like legal epi clinics. So if that's of interest to you, please do feel free to reach out. The Center for Public Health Law Research is also a great resource. There's lots of literature, self-paced trainings, webinars, data. And actually today at 1 p.m., they have a webinar on finding and using high quality law and policy data. There's also the Legal Epi Methods Consortium. So we are developing a set of journal reporting requirements through a Delphi process. I want to raise this for you all to prepare you to counter those. So hopefully that journals will be able to understand, what in legal epi we're looking for, and the authors will be able to understand what they are expected to report as well. And the Public Health Law Academy is a different resource. It provides training, research, and teaching tools for anyone interested in learning about more about public health law topics specifically. So if preemption was really interesting to you, that's a great resource. They also offer trainings on legal epi. And of course, there's some literature and textbooks and peer-reviewed articles that I'm happy to point you to as well. With that, I'm going to pass it over.
Thank you, Lauren. That was excellent. As Holly gets her slides up, I'm going to introduce her briefly. Dr. Holly Jarman is an associate professor of health management and policy, as well as global public health at the University of Michigan School of Public Health. Whether she's researching the impact of market rules and trade regulations on health, or trying to understand why states choose the tobacco control policies that they do, Dr. Jarman's research seeks to understand the political determinants of health, the impact of politics, governance, and policy making on health outcomes. Her publications address questions related to the relationship between tobacco control regulation and the world trading system, the regulation of cross-border health markets in the EU, cross-border collaborations to promote innovative public health and environmental regulation, and the impact of cross-border patient mobility on global health governance. Thank you, Holly, for being here. Please begin when you're ready.
Okay, I'm just going to check. How are the slides looking? Excellent.
They look good, yes.
Great. Well, welcome everybody. Thank you so much for having me. I get to talk about my favorite things, which are case studies and how to compare some of these cases. In tobacco control, we have to think very carefully about policies that are being rolled out on the ground. So we are always thinking about local jurisdictions. And so it can be very useful, especially when a policy is in its infancy, to really fully understand those jurisdictions, especially when we only have a few places that have adopted a policy. We already, because we're impatient in tobacco control, we want to know the effects. So my job is to complement the great presentations by Abby and Lauren and bring this around to, okay, so if we've explored in a larger end context, and we also want to add context and case data to our findings for in a smaller n way, what should we be doing? And particularly, I want to talk about the role of causal mechanisms and try to unpick those a little bit using case study data. So the problem here really is, there we are. The problem really here is that we want to identify policies that we want to be widely successful. And in order to do that, we want to compare policy outcomes across different jurisdictions. But of course, these are not necessarily particularly comparable. So jurisdictions have different government structures. They have different levels of capacity to implement policies. They receive and they spend different amounts of money. The market might be very different and dominated by different products. As Lauren has pointed out, the legal situation in terms of authority, applicable law may be very different. As Abby has pointed out, the existing baseline for law might be really different between jurisdictions. The population and health demographics might just be very different. So we need to make sense of this complexity, and ideally we want to separate the most important factors that are causing these policy outcomes from the rest. And I'm going to, given that this is an overview presentation, give you a sense of a toolbox of concepts and methods that you can use. We're not going to go in deep on any of them, but I'm happy for you to follow up with me and ask me more questions. So let's start with the most simple part. What are cases and case studies? So when I use the word case in this context, it's an in-depth study of something in the real world. So we have to study the messiness of the real world. But cases could be events, places, organizations. It could be an individual. And in this context, we're mostly talking about local level or state jurisdictions. But you have to carefully define what these cases are before the project starts. And so the process of doing that, we would call casing. So when I use the word casing, I'm talking about the process of defining cases, but also how the cases you are studying relate to other constellations of cases. We want to do that carefully and thoughtfully because it improves the external validity of what you're doing. So if you know more about your cases and how they are similar or different than others, you improve already the generalizability of your work and findings. So we want to do that in qualitative research. The second important principle and process here is case selection. So case selection is the process of choosing those cases in a reasoned and hopefully systematic way. So again, as Lauren pointed out, transparency is really important here. So a core element of this is documenting your justification for choosing those cases and not others. And this bears in mind that in this kind of research, it can be very labor intensive and maybe even time intensive. So we are trying to choose a small but yet somewhat representative body of cases to do a deeper dive into. This is really important. The case selection affects the internal validity or the robustness of your findings when you are comparing cases. So on the one hand, we want to do casing right and pick the cases, define the cases carefully. On the other hand, we want to do case selection right and select them carefully. And doing both together will vastly improve the quality of your findings. So why do we want to go to all this effort, given that it's a labor-intensive process? Well, here's a couple of different reasons. And this is very nice because in talking to Abby and Lauren and doing the interdisciplinary work that they both alluded to, it's great to have a clear reason for, oh, this is where my specialization fits in. So you might want to generate hypotheses. So maybe you observe a pattern in data, but you want to know why is that the pattern? And in order to do that, you maybe need to seek further information or context. One of your goals might just be to add context. So as Abby alluded to, if is this policy what I think it is on the ground? How is it actually being implemented on the ground? If you are thinking about things like enactment dates, maybe you also need to think about the implementation timeline where there is some discretion in how the law is being enforced. Maybe, you know, a lot of public health agencies will, in a tobacco 21 context, for example, will be going out and doing outreach and speaking to people and trying to get different retailers on board. So it is important sometimes to understand those things as well. Number three, you might want to address deviation from your expected findings. Let's say you notice that one state that's passed a quite similar policy to others and maybe has similar characteristics, that policy effect on outcomes was just not as big as you expected, or maybe somebody's a very successful outlier. So in qualitative research, we don't try to exclude outliers. We try to absolutely include them and maybe even focus on them as deviant information. Maybe we want to check the credibility of our analysis. So if you have conducted work similar to Abby and you want to check the credibility of that, you might be asking yourself, well, is this credible? Is the effect that I'm looking at just too big? Is this a credible magnitude of the effect? Something that you could do to try to check that is to learn more about what's happening on the ground. Similarly, you might try to address policy endogeneity through a case study. So in those cases of endogeneity, policy decisions are caused by the same factors that are influencing the outcomes you're trying to observe. So we have this problem of confounding. And then finally, hopefully you're all action-oriented or maybe participatory or policy-engaged researchers, and you get into tobacco control research because you want to do something that matters to health. So case studies and qualitative research can help to connect you in that way to the requests, needs, and opinions of policy communities and local public health actors. So how to do this? The basic principle is you need to start thinking about riding your bicycle. So what do I mean by this? Here is a short list of steps, and they're sort of in the correct order. But when we're conducting case studies in particular, we want to focus on iteration. Iteration is a central principle of quality here. So we want to make sure that you're making forward motion with your project. You're making progress in analyzing the work, analyzing the policy documents, analyzing the legal frameworks. But you also want to be iterating through the data. And so it might well be that even though I've put a simplified process up here, you are casing and also working a little bit on case selection and maybe iterating through these several times. So it's not a one-directional process for qualitative work, and that's important for the quality of the result. So I want to talk a little bit about casing, so the process of defining your cases. Here's a simple pattern. It might be more complex in practice, but what we try to do in casing is, first of all, define the unit of analysis if it's unclear. So sometimes it will be clear in tobacco control and you're focusing on a specific policy and you know, yes, that's definitely that I need to focus at the jurisdictional level. But other times, maybe there's a bit of slippage between the case, which is involves, for example, Tobacco 21, and the jurisdictional that you might be looking at. So, for example, in Tobacco 21, it can be quite common for cross-border contracting to happen. So maybe the implementation is nominally or technically occurring in a county, but actually they're cross-contracting with the local city Department of Health, which is providing implementation support for them. So you might need to think about your case in a slightly different way and actually engage with both jurisdictions to really understand what's going on. So we always ask in qualitative research, what is this phenomenon a case of? And we try to nail that down at an early stage in the research. We then characterize the case. So case study research is by design a mixed methods research approach. And so we bring in all kinds of qualitative data, but I'm almost always looking too at descriptive quantitative data. So I'm trying to give my case some attributes by layering on that data. I might look at demographics and smoking rates on the one hand, but I might also look at codes that I've applied to local laws, or I might be looking at public documents and layering that qualitative information into my case study. I then will try to categorize my cases. So this is the process which is a little bit derived from qualitative comparative analysis, which is a thing I will talk about in a minute. But the basic principle is trying to assign your cases to a set of cases that have the same characteristics. So let's say we have 18 jurisdictions that have adopted a particular flavor restriction law, or Tobacco 21, or minimum pricing would be another example. If we have a small n of cases, we want to maybe look through and try to assign our cases to sets where they have similar characteristics on variables that we're really interested in. We can do this with different degrees of precision. So it might be very true that when we look at a case, it absolutely categorically fits in one case or the other, and we can give it a binary code and assign it to one particular group. It might well be that we have to do a bit more expert analysis, and we say, well, the degree of belonging for this case in that set is actually 0.7. So we categorize based on the data that we've characterized the case with under step 2. We repeat this. So here's where the iteration comes in. And so we're going to be going through this multiple times. We're basically testing our initial casing. The second important thing, I talked about casing, and now I'm going to talk about case selection. Here are just a couple of things to think about and Google later around some approaches to small n case selection. So on the one hand, we might choose to pick our cases based on most similar systems. This is something that derives from John Stuart Mill. It's like a deep philosophical approach to case selection, but the basic idea is very simple. So we want to compare cases that are really alike in lots of different ways, but differ on an important outcome of interest. So, for example, very simply, if we have two jurisdictions that passed a Tobacco 21 law, and they have, you look at those laws and evaluate them, and they're quite similar. And then if they also have similar enforcement capacity and population demographics, but then when you look at outcomes, the policies really failed in A to produce the intended effect, and it succeeded in the other place. So why is that? That might be a good case for comparing, for example, pairs of cases that are very similar in most ways and different in one important variable. But we can do the opposite, and we could compare cases that are very different but share the outcome of interest. So here the jurisdiction A is a high capacity place with clear laws and a wealthy population. Jurisdiction B isn't any of those things, but the policy just wasn't successful in either place. So I hope you can start to see how by doing this kind of careful case selection, it will tell you more immediately about the likely causation in these cases. One I will point out that's quite useful, especially if you're doing mixed methods, is marginal case selection. So here we can select our cases that fall either side of a given threshold. So let's say if I look at my 18 jurisdictions that have passed a Tobacco 21 law, and I can put those cases on a continuum for one particular quantitative variable that I have. And maybe I make a theoretical judgment to say, here's a threshold of importance in how I'm measuring that outcome. And then I'm going to look at a surprising case on one side of that margin where maybe this jurisdiction has really clear authority to act, but the policy just didn't reduce smoking. And I'm going to look at a surprising case on the other side. This jurisdiction has really complex or muddled legal authority, but the policy succeeded. Like, why was that? So marginal case selection, looking at cases that are surprising, can be a really effective thing to do when you have both a quantitative measure across the cases and then you want to go in deep with qualitative assessment. All right. So expanding your dictionary of useful concepts even further, these are all things that I'll quickly touch on that I want to see if you're writing a grant proposal that includes these elements, or if you're writing a journal article and you're reporting on your methods. So we already talked about coding being the process of reducing quite rich data to representative concepts and themes, and you use labels that are attached to the text, and those are codes. I want to see in your grant proposal, how are you going to analyze what's going on within each case? So we talk about within case analysis, and this is assessing outcomes and factors that explain those outcomes in a single case. And I will talk in a minute about process tracing. You could also, I want to see too, cross-case analysis. What is your method for actually systematically comparing the cases where you have more than one case? This is really important because in the example of Tobacco 21, we started off with some studies very early on of Needham, Massachusetts, which was the first place in 2005 to actually have such a policy. And there was a lot of extrapolation just from that single case. And some of the cross-case analysis of comparing Needham with the next couple of cases that adopted the same policy really could have done with more of systematic means of comparison. It can be very tricky to do this kind of comparison and very easy to dismiss it when you just have one case with particular characteristics. This is something to flag for people who want to do this kind of work. A mixed methods approach to doing cross-case analysis is actually qualitative comparative analysis. I know we like our ridiculous acronyms in qualitative methods quite a lot. So this is for comparing small to medium numbers of cases, and again uses set theory to compare different configurations of case characteristics. So instead of comparing one variable across your cases, you're looking at clusters of variables, configurations of variables, and how they make a difference in the outcome you're interested in. I am happy to answer questions on that, as it's quite complicated, and I'm not going to go in depth on this one, but please come see me if you want to use this, because despite the linguistic barriers to entry, it uses its own terminology. It's actually quite a straightforward method once you get into it, and I would like more people in tobacco control to use it. So some tips. When you have a text corpus, which is a body of text, so maybe you have looked at the laws, and maybe you're actually conducting some kind of legal epidemiological review, but maybe you're also looking at a lot of policy documents, so minutes, guidance, other kinds of official documents where you are drawing from that a sense of the narrative of what's happening in this jurisdiction. Here are a couple of considerations for how to do that, because the main challenge for you guys is that you need to balance the need to be more comprehensive with the practicality of you most of the time being a single person or a small team. I absolutely endorse Abby's point here of like teaming up is good, and you probably need more people than just one person to do some of this. But when you're looking at a big body of text, it's really important to think, if you're interested, are you interested in these documents as containers? We quite often do content analysis in public health. And are they buckets of text and you don't really care about the bucket, you just care about the content? Or do you care about these documents as part of a system? So I would think about this more as an irrigation system. So we maybe need to know a little bit about what the documents tell us about relationships between different actors in the case. The main challenge here, we need to balance completeness with practicality. So we need to start identifying potential documents for analysis at an early stage. A good way to do this is just know your field. So if you come across published peer-reviewed articles with relevant methods sections, you should practice reading those, critiquing those, and then trying to emulate good practice. This is why I say the core of this is developing almost a dictionary of concepts, some of which I'm trying to give you today. Always run multiple test searches before you analyze any of those big body of documents. And you might want to, if you realize, hey, there's just a lot of documentation across the jurisdictions I want to look at, I might need to refine the time period I'm looking at or the number of cases in order to make this a practical piece of research. Always separate those documents by type. Don't put different types of data in the same corpus, but do follow the principle of triangulation, which means I'm going to compare what I have in my legal database with what I have in my policy documents database with maybe the quantitative descriptives I've collected and other sources of information. I'm looking for agreement across information sources. And then finally, always keep a research diary. So I would document this pretty meticulously. You need to know the source information, the search terms you use, the descriptive statistics, metadata maybe about the documents you're looking at. And then as you do coding, you're going to record your codes. You're going to record the categories where you clump codes together. And you're also going to keep a written commentary of your reflections on what you're finding. It's really important for improving the quality of what you're doing. All right. I wanted to touch on process tracing really quickly because it's very helpful for this untangling of causation. This is a form of within-case analysis. So you're looking here for causal links in a process or a chain of events. It's really helpful, therefore, for policy implementation questions. There are different forms of this. You might choose to create a logic model of what's happening and then examine what happened in the real case, or you might examine real cases in order to create your model or improve it. How do you do this? You're identifying and collecting documentary evidence that is going to link the actions taken with the outcomes you're observing, and that should be at each link in a causal chain. So you might want to look at how the tobacco 20, going back to our tobacco 21 example, how the law was passed in the beginning. You might want to look at the dates at which it becomes effective. You might want to then look at also what guidance has come out and what decisions were made around how to implement things like outreach, things like retailer education plans. So you would map each of these causal chains of events that are contributing to the outcome you're seeing, and you're going to saturate each one of those points of decision making with a whole bunch of documentary evidence from different sources. Under process tracing, you also then apply a bunch of evidentiary tests in order to either eliminate some of the hypotheses you had about what was going on, or confirm those hypotheses, or in the middle ground, maybe add some inferential weight to something that seems like a likely causal factor. Despite the jargon, again, super powerful method that is quite flexible and can be used in different contexts. So I'm happy to answer more questions about this. All right. When you're trying to support quality across all these different methods, there are some individual factors you need to take into account. You want to, in all qualitative research, decenter yourself. This is not a project about you. It is hopefully a project about those communities that you are studying. You also have to cultivate a bullshit detector. So you're trying to evaluate all the information that you're seeing to see how credible the narrative is that you are building. Don't fall in love with a particular narrative of, I'm sure this is what's happening, without the requisite evidence and evidentiary tests. You want to build a concept dictionary and a toolbox of different qualitative analytic approaches, some of which I've listed here, and I have a resource slide in a moment that will help with that. You do want to go in with context knowledge, as Abby pointed out, as Lauren pointed out, because you need to have that background in order to interpret what you're seeing. The second stream of activities are based around building a team, as Abby suggested, or engaging with communities, because you're studying real places with real consequences. So you want to engage with existing research and research networks, but also practice networks. So coming to seminars like this is a great idea for that. This is why we need centers like CAsToR and other TCORS centers. And also, you want to partner up where you don't have the skills or the knowledge. But an additional thing to what Abby was noting, if you don't have favorable positionality in terms of your identity and your receptiveness to an audience that may not be like you, it's worth thinking carefully about those elements of identity. Should you be doing anything where you are talking to a community, engaging or partnering with them, maybe doing some interviews on top of the documentary analysis you're thinking about. In terms of design, I've already mentioned saturation, which is a word for adding layers of documentary evidence to prove a point in your case study. Thick description is a similar idea, which comes from anthropology and ethnography, but it's very applicable to all of this work, where you are going to layer on different bits of information and try to describe in some detail the relationships between the different actors in your case study. So the policymakers, the retailers, other stakeholders, and the public, and try to understand their roles in this case, in order to improve, again, the generalizability of what you're finding. Triangulation I've mentioned, but bringing two different sources of information together to confirm or support the narrative that you're building. You want to pay attention to deviant information. So this is what I said about outliers. If we have an outlier, in qualitative research, we try to include it even more. So if there's a different account, if some documentation has a different account of how this was rolling out in a jurisdiction, you really need to go and look at that and pay attention to it, not dismiss it. There are a range of other different credibility checks that you can do. Intercoder reliability is one of them that you might be more familiar with, which is where if I have a big body of text and documents, or if I'm doing legal analysis, I might want to have two coders independently look at that coding, look at those documents, apply the codes, and there will be points of trying to reach agreement, so discussion between the coders. Under a lot of models, you can also apply some statistical tests to the codes in order to see how far apart the two coders are. And ideally, this should be an iterative process where we reach a point where there's good agreement on what this body of text or this body of law says. Member checking is going and reaching out to people in that jurisdiction and checking their sense of what your narrative says. And then, of course, there are evidentiary tests associated with process tracing. And all of this needs to be quite organized. Your project management is another form of quality control. All right, this is my last slide. So we just wanted to leave you with something that can help build that concept map I was talking about, because this is a broad field with a lot of different bits of jargon. I cannot recommend enough. SAGE has a research concept map, including all of these qualitative and case-based terms, and you can then use that same map to search for resources. They have videos on qualitative comparative analysis and a bunch of lessons. They have lots of textbooks that do a deep dive into some of these concepts. Another thing is the RWJ's Qualitative Research Guidelines project, which is a little older but has a really good dictionary of different qualitative terms. You might want to use specialist databases. One I like a lot and use is Overton. This is looking for grey literature, policy reports, documents, some of which might not be immediately accessible through something like Google Scholar or PubMed, but you might want to look at those because they pertain specifically to the jurisdiction that you're studying. And there's a range of books here as well, which I'd be happy to chat about, always happy to chat about books. I'll just leave you with the idea that this is the kind of work that can really make a difference in your larger N analysis that you're looking at. And it's only really through collaboration with others like Abby and Lauren, again, interdisciplinary work to understand the language and bringing us together to have these conversations in centers like CAsToR that we're going to achieve that. So I'm really glad to be here and thank you for paying attention to what I had to say. All right, gonna leave it on questions.
Thank you, Holly, and Lauren and Abby. That was a wonderful set of presentations. I think there's a lot of information that you shared in this primer workshop. We appreciate it. Folks have submitted some questions, so we thank you all who have submitted questions. Please feel free to add more questions to the Q&A. I think maybe we should start with the unanswered question and revisit some of the answered questions as we move along. There was a question by Claire Ma. I think this may directly relate to Holly's talk, is when selecting cases, if we have an ideal case comparison based on comparative logic, but there are major data limitations regarding one or more of the selected cases, what are some guidelines for how we might approach this issue? For example, how to approach picking imperfect substitutes and things like that.
That's a really great question, Claire. It's really common, unfortunately, because, and as all of you appreciate, this data is often really messy. And what we think would be an ideal comparison in theory when you go and look at documents, which you should be doing as early as possible so that it can inform the case selection, you actually find, oh no, half of what I need is missing. So I would start by looking at documents early and often, trying to assess the scope of what information is actually available before you actually nail down your case selection, but also transparency. So if you are in a situation where the case comparison is not as ideal as you would like, but it's good enough to produce a robust result, the most important piece of quality control there is to write about this. So you need to explain the data limitations. You need to be explaining that in grants. You need to be explaining that in papers. it might help that you, if it's a jurisdiction that you know a little better, community engagement or policy engagement might help too, because it might just be the case that the information is available, but it's not available in the format that's easily accessible to you in that moment. So those would be my 3 answers.
Great. Anybody want to add more to that, Lauren or Abby? Probably not. Okay. There's a couple of questions that were answered already, but maybe folks like who did not answer the question and type in writing may want to add their own perspective. The first is by Adriana Perez. Do you need to be a lawyer to do this type of research? I think Abby answered that. I think from her perspective as an economist or health economist doing this type of work. Lauren or Holly, would you like to chime in on that? Or do you need to be a lawyer to be a legal epidemiologist? I guess maybe the question.
I'm happy to chime in and say I get this question a lot, and the short answer is no, but you should make friends with one or consult with one or get training from one. There are many folks doing legal epidemiology who are, not like JD in the title, and that's great, but they have a lot of experience and a lot of subject matter expertise. So I would say, there's a lot of opportunities for training and exposure and practice, but would also say, call your local collaborator too. But no, you don't specifically have to. Just be wary if you are out there on your own. But there's many folks who would be happy to help you.
Yeah, and I'll say from a non-lawyer perspective, like if I'm doing something that looks a bit like legal epidemiology, I will be really careful. But also, like, I have a degree in political science and legislative studies specifically, and experience studying the US. So it wasn't until much later that I would think about applying some of these methods. And again, I wouldn't do it without thinking about it carefully and getting feedback from people who are real experts.
I think a good rule of thumb is if there is a degree that specifically trains people in the thing you're trying to do, and it's not the degree you have, at a minimum, ask someone who has that training to quality check your work. I'm an economist, so I'm like, yeah, randomly select X number of the cases and have them recoded. There are plenty of legal epi people you can hire as consultants to do that. Better to be humble than to totally miss the mark in something that you've published.
I have a related question. I guess legal epi is somewhat of a newer concept, at least in my view, or training. Are there training programs in legal epi in this country, and where would you get that training?
There are a lot of training programs. My team has Lauren help train our people, and we sometimes also send them to the Policy Surveillance Institute at Temple, which is a summer program. I would not substitute that training for having a lawyer on call. Even my wonderful RAs who Lauren is involved in training still have to check with her on things. Sometimes, especially local policy, sometimes it's confusing or there's no definition. Sometimes state policies require looking across different statutes and areas of code. The law is very much a kind of gate-kept language. So you can get this training. I recommend getting this training. It is never a bad idea to have a second set of eyes if you're collecting the data yourself.
Mm-hmm. Yeah, and also for international researchers as well. I know there's definitely interest in doing like international legal epi work. It's not just like a U.S. Centered thing. But yes, in addition to Temple's trainings and certificate programs, I know I conducted trainings through the Office of Public Health Law Services at CDC in the past, and the Public Health Law Academy, as well as a self-paced online training. So there's different resources to tap into. If there's interest in a particular training, please do let that be known. That would also be very good to know.
I'd also note, Ritesh, the standard of evidence for both legal epi and like de novo data collection is dual coding. So if you're working alone, you cannot dual code, which means if you're going to collect de novo policy data, before we even get to the like is there a lawyer? You should not be the only one who has eyes on that. Someone else needs to code it, and you need to confirm that your coding matches. Ideally, that person will have, and you or multiple other people will have legal research skills. If they don't, have a consultant who is a lawyer or a legal epidemiologist audit your data. I say this as someone who's found problems in her data in the past and was very happy to have someone come in and tell her, no, you're wrong. That's not how you should be reading this because you ignored this other statute that modifies the effect.
Great. Thank you, Abby. Another question from Claire. Is legal epidemiology typically a large N method? What are the key limitations associated with this method compared to other methodological approaches in policy evaluation or implementation studies? I know, Lauren, you answered this, but maybe Abby or Holly have some insights.
I'm going to reveal my own lack of understanding. What do we mean when we say a large N method? That is not a term that I'm familiar with. Maybe Holly can elaborate, or Lauren, whoever responded, because I was not sure. That's just not a phrase in my field that I'm familiar with. Do you mean when you're
that's because your field is definitely engaged in it? So I would, from a social science perspective, call anything with just a few cases a small N, and then there's a gray area of anything up to like 50 cases. So
okay, so yeah, we're always doing large N's unless we're doing static control, it's a large N.
Yeah, and then in policy studies, you're quite often doing something that's medium to small, because if you're studying the United States, there are only 50 states. So,
right.
Yeah.
So, yeah, it depends on if you're looking at the level of the policy you're looking at, right? Like if you're looking at a federal policy, you're looking at a federal policy, right? There may or may not have been pre-existing policies at the state level, which you should consider, right? Treating a policy as turned on and off by a federal law when a subset of states already had the law in place is going to misidentify your effect. But if you're looking at local jurisdictions, it's definitely a large N all the time. And then you also need to think about the representativeness of the data you're matching the policy to. So if you're using a survey data set that's representative at the national level and not at the state level over time to look at policies that vary substantially at the local level, you need to start thinking about whether or not the localities that are represented are being observed over time, or if there's some kind of bias because your sample is not representative at the level of your policy. So yes, large N, and also for the quant people here, it comes in on how you think about the data you're matching to it as well.
Great. Thank you, Abby. I think that reiterates some of Lauren's responses there. There's a question by Nargis, and I think, Lauren, you answered that, but maybe we can think about some international data sets if possible. I think that maybe some of the more US-based data sets were mentioned by you and Lauren and Holly. What are some common legal databases, preferably open source, that one can use to search for legal data and policies related to tobacco?
I will say that I don't know of international legal databases. In my experience, systems of law differ. And also, if you're only searching in the English language, you are inherently biasing your results. I am a strong proponent of understanding the culture you're studying very thoroughly and making sure you have representation from that culture, or at least fluency in that culture, on your team. So I have not attempted to do this without actually doing deep dives on national laws. I will say that one of the big differences between the US and a lot of European countries is the amount of local policy variation that creates these natural experiments. A lot of especially since the formation of the EU, a lot of the policy changes that are informative are EU level. And that is a different kind of variation. There's no EU. If everyone in the EU adopts the policy at the same time, there's no within EU non-adopter to compare it to. So it really depends on the country you're studying, and it really depends on the policy you're studying, and also the potential illicit markets. Yeah, this is an area where collaborators or regional expertise yourself are going to be really critical.
I'm gonna also just point just off the top of my head I'll first say that like a lot of data sets are found like hidden in papers. So like a review of the literature, you might happen across a data set. And that data set's gonna look really different. There's not like one like big repository somewhere, unfortunately, yet. Yeah. And then
Yeah.
I would also point you toward the Global Strategy Lab. I put the link in the answered question. They, I know, are internationally focused, looking at like international treaties and organizations pertaining to tobacco work. And they also have I think they recently published on advancing tobacco control through gender data. So I know that their like perspective is a bit more like global. So you can check that out for an idea about the intersection of tobacco and something more international. Otherwise, looking at universities that have both like public health law programs. I know Georgetown University has like a public health law focus and health law focus. So they might have some data as well. And then universities abroad may also, you want to check out their like law and policy departments for their information.
Yeah, and I would say too, it matters quite a lot depending on how many countries are you trying to characterize. So sometimes the objective will be an overview, and so you might find good quality stuff in peer-reviewed publications, but it does depend on whether the data is attached, whether it's explained really clearly, like how did they derive that. And so sometimes in that work, it can be a bit difficult to go beyond some quite simplistic description of what the mechanics are across a wide range of countries. I am obviously a proponent of international case studies for smaller groups of countries. Particularly, I mean, I will try, when you're doing case selection and trying to understand, so this would be more of a law in action question than a legal epi question, but if you're trying to understand what was happening or how things were implemented across a range of countries, I'm going to stick to regions I know. I'm going to stick to North America. I'm going to stick to Europe where I have some expertise, or I'm going to partner specifically with other people who know what they're doing. So even there are useful, expert validated international data sets for some forms of governance, like VDEM has a bunch of interesting measures that talk about governance and authority in different places. They will not be health specific or tobacco specific for sure. It might be good to triangulate between that, which gives you a sense of institutional differences, and then apply subject matter specific knowledge on top of that. But you've got to do it a bit carefully. So come find us if you want to do this kind of thing, especially if you need help, like trying to understand a small subset of cases, which is what I would recommend the most.
Great. Thank you so much, all of you. I don't see any other questions on the Q&A. So I think we'll end it here. I really appreciate all of you, Abby, Lauren, and Holly, for doing this. I think this is a great workshop and a great primer. So thank you for being here, and thank you all the participants for being here. Make sure to fill out the evaluation questions that Molly put a link to. Okay. Everybody have a great Thursday and a great rest of the week, and we'll see you next time.